And now to the latest on the COVID-19 situation here in the country. The South Korean government has introduced basic quarantine guidelines for the public once the country makes a transition into everyday life quarantine from the current social distancing measures. Now, this comes as the country continues to see a sharp downtrend in the newly confirmed COVID-19 cases. Our Kim Hyo-sun with more.
South Korea's quarantine authorities have announced basic quarantine guidelines that the public needs to abide by on individual and community levels. There are 5 basic rules for personal quarantine. Stay home for 3 to 4 days when you feel sick to get a sufficient amount of rest. Keep a physical distance of an arm's length. People are also advised to wash their hands thoroughly with soap and water for at least 30 seconds and stick to polite coughing etiquette. The quarantine authorities say it's important to ventilate at least twice a day while advising individuals to stay psychologically close to family and friends despite social distancing. The supplementary rules for individuals include wearing protective face masks and abiding by daily health guidelines for high-risk groups, including senior citizens. On a community level, people are advised to designate a certain person to be responsible for quarantine and calls for the rest of the group to be fully cooperative with him or her. Daily body temperature screenings are also required to keep the community safe. Above all, the quarantine authorities highlight cooperation is the key.
The guidelines are available on the website of the Health Ministry and on the COVID-19 monitoring webpage. They will be finalized after a thorough review and will be distributed to the public.
The Central Disaster and Safety Countermeasures Headquarters also plans to provide specific guidelines for different settings, including public transportation, restaurants, shopping malls, and wedding ceremonies.
Around 20 guidelines will be released on Friday, focusing on essential daily life quarantine measures.
While these guidelines are not compulsory but advisory in nature, health authorities believe there's a need to make some of the most essential ones compulsory. They're also mulling fining those who fail to comply. Kim Hyo-sun, Arirang News.